peroneal tendons insert into the styloid process of the fifth metatarsal, and we have some irritation there for the peroneus brevis, and she's also saying down on underneath the cuboid peroneal groove that the longus is also having some irritation. It's come across the
right there, your thumbs,
are responsible for everting the foot and pulling it out. And both of these then converge right here underneath the calcaneal lateral groove for the peroneal tendon, and that also shows some swelling that we were able to identify in the ultrasound. And she's saying to a lesser extent up here as we start to go into the musculotendinous junction of the peroneal tendons. Mostly we're talking about the lateral column of the lateral wall of the calcaneus and the lateral process, and then the peroneal groove on the cuboid.
So, and then just, what do you think then? Then we'll just probably going to reduce the hypercure stent size.
Yeah, so we were talking about the pressure that the hypercure device places inside that joint, and just doing a comparison x-ray between the right and the left, there is a little bit more of a posterior displacement of the cymaline on the left compared to the right, which indicates to us that there is more of a correction occurring in the left subtalar joint with the subluxation that we were experiencing. And so it is limiting the amount of pronation that can occur, and she's developing irritation associated with that, and possibly some of the peroneal spasm to the tendons because of that limited motion. So she's fighting against it a little bit.
Yeah, now that I'm finally standing, the good news, you see that I'm standing under my legs. They're underneath myself. You've reviewed my videos of me walking the treadmill. And would you agree that I have really improved 100% in almost 2 years that you've known me? It'll be 2 years this September since you've known me, and changed of walking with my leg underneath myself. And
considerable change with the lengthening of the Achilles tendon, with the corrections of the subtalar joint position and alignment, and also with stabilizing the ankle joint. Considerable difference and improvement.
It is wonderful. And how would you, I forgot to ask you this yesterday, in your overall opinion now, after it's been, what, 5 months surgery? Yeah, it's been 5 months since my endoscopic gastric recession. So I forgot to ask you this yesterday. You might have said it, but just for my video, will you describe, I mean, how do you think the tissue and the muscles?
The tissue has responded really well. She's worked really she's been very consistent with physical therapy and with massage therapy, broken up any adhesions back here. The aponeurosis doesn't have any type of a groove that is felt along this area. Much improvement, much more dorsiflexion of the ankle now. She is much more equal between the right and the left side at this point.
It was a miracle. What can I say, Dr. Jack? Thank you. So, okay, so we're going to give it up today, do some PRP into the tendons, a little more pain to hopefully get some gain and help that in the tendons, and then we'll address the hypercure later this year. Thank you, Dr. Jack.